About 3.5 million Nigerians are currently living with HIV/AIDS. Unavailable data reveals that this critical situation leaves women and young girls of reproductive age at the receiving end. This challenge inspired the AIDS Healthcare Foundation to bring this advocacy campaign to the grassroots.
Young women and girls are the ones that are abused. Young women and girls are the ones that are giving out in early marriage against their will. We need to raise our voices against this population of people. We must focus strategies to stopping those sociocultural practices that are making young women and girls more vulnerable to HIV and AIDS. We want to carry our campaigns to the very remote villages.
We're taking it down to the communities. We have strategized to know all the communities we have, and we are working in groups. We're working with the women groups, we're working with the youth groups.
The campaign also seeks to encourage affected women not to shy away from accepting their status, which will in turn prevent mother-to-child transmission.
The question is, what is preventing women from coming out to get tested? Because if you can change that data, more women coming out to get tested, more women are more likely to be positive. We will actually achieve the first 90 of UN aid.
We are saying no to zero new infections. We are saying zero new discrimination against persons living with HIV. We are saying zero to AIDS-related deaths.
Despite the anti-stigmatization law, discrimination still remains one of the challenges facing the fight of the disease in Nigeria.
There's a lot of discrimination going on because most people living with HIV/AIDS don't really want to come out because of what the person out there will say about them. So they are still living within their shell. They are still living within. They don't really want to come out to say this is what we are passing through.
The awareness that we're supposed to receive in the rural areas, that is in the communities, under Kuje Council, is not up to 100%.
If Nigeria must bring the HIV/AIDS endemic to an end and attain the target by the year 2030, the AIDS Healthcare Foundation believes only advocacy and community mobilization can bridge the gap and end the scourge. Ihoto Odo, AIT News, Abuja.